Hi everyone, this is Camila and we are going to be talking about congestive heart failure. My patient is Mr. T. He's a 70-year-old male. He is 5'8", 240 pounds, and he was admitted to the hospital with shortness of breath, fatigue, abdominal distension, swelling of the ankles. Mr. T's current diet consists of whole milk, ice cream, cheese, pizza. He eats very little fruits and vegetables. He likes Mexican and Chinese foods. He also enjoys beef, chicken, pork, and shellfish. Mr. T is 5'8" and 240 pounds. That will put him at a BMI of about 36, except that he has edema and ascites, so a lot of his body weight is due to fluid retention. So once the medication that he's taking, the furosemide, the diuretic, begins to work, it will be easier for us to know his actual body weight. So it's very important to take that into consideration when calculating his energy intake needs. Mr. T currently has dyspnea, so he has difficulty breathing. He also has edema at his lower tibia and ankles. His blood pressure is about 115/80, and his heart rate is 110, so he has slight tachycardia. So when calculating Mr. T energy needs, I had to take into consideration that a lot of congestive heart failure patients end up malnourished. But because Mr. T has edema currently, it's very important to lower his sodium intake. So that is actually my main concern. I use the Mifflin-Sanjor equation with an activity factor of 1.2, but I think the most important thing for him right now is to keep a healthy sodium intake level, not too low because that can have adverse effects, but about 1,500 to no more than 2,000 milligrams a day will be ideal for him. Okay, so the intervention for Mr. T, I believe that adopting a heart-healthy diet, which seems self-explanatory, is going to be important. We definitely need to address his sodium intake, but there are a lot of tricks that Mr. T can incorporate so he doesn't have to completely give up the foods that he likes. So for example, there's a drastic difference between American cheese and Swiss cheese when it comes to sodium content. And we're gonna work with Mr. T and make sure that he has the skills that he needs to make those modifications. So some of the skills that I believe Mr. T could benefit from, or any patient that needs to lower their sodium intake, is to be proficient in understanding food labels. So for example, this cheddar cheese has 160 milligrams of sodium per slice. This Havarti cheese has 130. Meanwhile, this other Havarti cheese has 190. So say Mr. T is at the store and he has two different Havarti cheeses to choose from, one with 130, one with 190 milligrams of sodium. I would say go for this one because that difference, you can have another fun food with it for the budget, for your sodium budget, right? So sorry for the crunchy sound, but for example, when it comes to bread, say Mr. T is trying to have a sandwich and we already discussed cheeses. Now let's talk about bread. This bread, just white bread, has 140 milligrams of sodium per slice, one serving. So we gotta add up 140 times 2 plus adding the cheese. Well, we're getting up there in the sodium, right? Then over here, this one on the other hand has 70. Oh, that's half the sodium. So let's try to find Mr. T some options where he can have a win-win situation, have his sandwich and eat it too. So on the next slide, I'm going to add fun handout from the American Heart Association on something called the Salty 6. So there's some foods that have that hidden sneaky sodium that you might not know about. Some are self-explanatory. For example, most people would know that processed meats will have a lot of sodium, but there are other things that have hidden sodium. For example, bread, as we just discussed, because sometimes you don't know how much is in it. So it's important to have that knowledge. I also say chicken. Some chicken is packaged in a sodium solution, right? You know, like a saline solution. So choosing chicken that's not in that kind of solution will be beneficial for any patient that needs to cut back on their sodium intake. As you may know, as we age, we lose the ability to taste food. So that is why so many people add a lot of salt to their food. However, on the next slide, I'm going to leave a list of fun spices. Okay, so now that you know what's going on with Mr. T, I'd like to take you back on a trip to Nutrition 224 and talk about the blood flow through the heart. No, just kidding. I'm not gonna do that. I do think it's fun though. But what I will talk about is congestive heart failure. So when you hear heart failure, it sounds like the heart completely failed, but that's not really what's going on. So congestive heart failure is defined as the heart's inability to meet the body's demand for, blood and oxygen. It can happen due to left-sided ventricular failure or right-sided ventricular failure. And on the next slide, I'm gonna describe what's going on in case you're interested in knowing more about it. As I mentioned before, heart failure can be left-sided heart failure or right-sided heart failure, which my left side is here, my right side is here, so don't mind the sides. With that being said, right-sided heart failure usually occurs as a result of left-sided heart failure. So by the time that somebody presents symptoms of right-sided heart failure, which mainly you would be able to tell because they will have the jugular vein is going to be distended. It's going because there's so much buildup of fluid in their body and the lungs, and usually that's because the left side already failed. So when I put on the next slide everything that's happening with Mr. T and the comparison between left and right-sided heart failure, you'll be able to see that Mr. T has biventricular heart failure, which of course that's a medical diagnosis, is not in our scope of practice, but I think it will be important and valuable for you to know the difference between them, because if you encounter a patient that has heart failure, you'll be able to tell the difference. Okay, here's just some fun fact. So Mr. T is not a drinker, but as you may know, there are benefits to, for example, red wine consumption, right? However, if someone has congestive heart failure, they should not ideally drink at all. Now, for the people that want the benefits from red wine because it helps the HDL levels, they can also choose to have a non-alcoholic red wine because the resveratrol is what actually helps with the HDL level. Now, on the other hand, if you are partying too much and overindulging on the red wine, it can actually raise your LDL levels. So enjoy responsibly. This is for my fellow classmates. You know who you are. Well, thank you for watching or reading or skimming through it. if you want to know more about the heart or the resources that I use, or if you have any questions at all on congestive heart failure. I know that I just briefly talked about everything that's going on here. I hope the resources that I added to this presentation are helpful and that you learned something new. Feel free to email me if you want to know more, and if not, that's fine too. Have fun, finish the semester strong. I miss you all, and I will see you soon.